Hi, my name is Jenna Luché-Thayer. I'm one of many thousands of Lyme advocates. I'm also a former senior advisor to the United Nations and to the U.S. government. I've worked on many U.S. government federal programs and done assessments and evaluations. My areas of specialization are government accountability, transparency, and in particular I've worked with the integration of marginalized groups. I've done this in over 40 countries and for 30 years. I'm going to use these skills to explain to you a bit why we are in the situation we are in here in the US and many other countries because of the CDC. This is a governance issue, and this is what I will be talking to you about. It is also an issue of marginalization, and I will be discussing these themes throughout my presentation. Now, this is going to take some time, so relax. I'm going to basically share it with you in a conversational form, reading some from my notes, and I hope that you learn quite a bit. Thank you. I'm going to talk about how the CDC has violated a number of federal laws and statutes, how CDC Lyme policies and programs are not based on good science or even the best science, and how the Centers for Disease Control and Prevention have a special relationship with the IDSA, which is the Infectious Diseases Society of America, IDSA, and how this has shaped their federal program for Lyme. I'm going to talk about some misappropriated grants from the National Institutes of Health and how the Antibiotic Stewardship Initiative is being exploited by the IDSA. And this will be followed with a series of recommendations. I'm going to begin now. First of all, a summary. CDC Lyme disease policy and programs, what they do is they restrict treatment access. They are not patient-oriented. They are not based on best science. They are non-compliant to a number of federal laws and statutes, as well as advisory boards' recommendations. They fail their strategic objectives, and they are a waste of tax dollars. What are the consequences of this? Well, over 25 years, we now have hundreds of thousands of Lyme patients in the United States that are having unnecessary suffering, financial ruin, their families are destroyed, and many have disability and death. The CDC mismanagement costs have yet to be fully calculated. In April 2006, there was a publication in the Emerging Infectious Diseases Journal, which said that for about 329,000 new infections per year, it cost the U.S. taxpayer $3.7 billion. And this is per year. This is the cost. And these costs are probably escalating because the numbers of people infected is simply increasing. How has this happened? Well, first of all, the CDC has disregarded a number of congressional directives. Every year, the Congress writes appropriation bills, and these are the monies that go to sponsor federal programs in federal agencies. And with these bills, they're called appropriations bills, there's something called congressional directives. And often these congressional directives are detailed the ideas on how a federal agency should be doing its business, and they often are accompanied with a specific set-aside of money called an earmark. In this case, the CDC basically disregarded or failed to follow congressional directives to advance Lyme science, diagnostics, and treatments in the year 2002, 2010, and 2015. A recent letter from Arend, who is the principal deputy director for the CDC, stated, although committee reports, meaning the congressional committee reports, may include language that encourages agencies to work on programmatic activities, Only the appropriations bill signed by the President includes directives to be carried out by federal agencies. There were no directives specific to Lyme disease in the FY 2002 Labor, Health, and Human Services and Education Appropriations Bill. Now, this kind of goes against all legislative behavior and institutional behavior since there have been appropriations bills and directives. It's true it's not a requirement by law, however, it is something that is routinely done by federal agencies, and they report to Congress regularly on how they have met directives and how those monies have been spent. One thing that's particularly striking is that with the 2002 appropriations bill, there was a section called the Infectious Disease Control Earmark Directives. And all the infectious diseases under this area of the directives, those targets were met. They did the things that were required and requested by Congress. However, they completely ignored Lyme disease. That was the only directive that they ignored. The 2010 appropriations has an earmark of almost $9 million. Some of the commitments were initiated, most were not met, and there's no accounting for most of the money, at least in the documents that have been submitted. 2015 appropriations to CDC for Lyme disease has an earmark for almost $11 million, and we do not yet know if any of those things have been done. There's something called an ethical conduct section, which is a federal body of laws regarding federal employees, and everyone who is a federal employee must adhere to these laws because public service is considered a public trust. One law is that employees shall put forth honest effort in the performance of their duties. Now, this is very questionable in the case of the CDC because they are promoting non-compliant substandard Lyme tests and substandard non-compliant Lyme treatments. So how could they possibly be putting forth an honest effort in the performance of their duties? Another statute is that employees shall act impartially, not give preferential treatment to any individual, private organization. However, the CDC has been showing continuous preferential treatment for the Infectious Diseases Society of America, the IDSA, and this is the only disease with which the CDC is involved where they promote one private organization. The other statute that is called to question is that employees shall disclose waste, fraud, abuse, and corruption to appropriate authorities. As we go along, you can answer this question yourself as to whether this has been done. It's not just if you yourself are involved with waste, fraud, or abuse, but if you observe it on the part of your colleagues, then you should be reporting it to the Inspector General. Okay, there are also routine standards for transparency related to classified and non-classified activities. There is a program called Lyme Corps. Have you ever heard about it? Well, very few people have. Lyme Corps is an unclassified public education program that trains public health and healthcare students to disseminate Lyme disease information and education to the public. So it should be a fairly well-known program. It's being implemented throughout the nation. It's involving multiple universities. It's involving county and state health organizations. And it's involving many, many private healthcare centers. And yet few people have heard about it. In fact, up until May 12, 2016, there was no reference to Lyme Corps on the CDC website. They just posted it on May 12th. The program has been in action since 2013. So that's 3 years with no posting or reference to this program. If you called CDC and asked them about it, they had no information about Lyme Corps. I know because I called multiple times. In 2013, Lyme Corps recruited 10 members from Drexel University, distributed over 1,500 printed materials, had 23 presentations to clinical staff at medical practices, with an average size of 1,800 patients each, or that's 41,400 patients, presented to health officials in a variety of age groups, presented throughout public settings, parks, schools. However, to this day, I have not been able to secure any information, basic program information about Lyme I submitted a Freedom of Information Act. Typically an unclassified program, you'd be able to go right on the website of the organization, get the information very quickly. How much are they spending on it? Who are the partner institutions? What are the program objectives? All of these things. This is not readily available. Some of the information is now available. They've made reference to a few activities they've undertaken. However, again, it's an unclassified document, unclassified program rather, and what I should be able to easily access is the strategic objectives, the program objectives, geographic areas and how it's going to be rolled out, any annual and quarterly reports, any assessments and evaluations that have been done, annual funding and overall budget, numbers of intended clients and beneficiaries. This information has still been not forthcoming. If you go on the web, on the internet, and you type in Johns Hopkins Plant Nursery Sale into the Google bar, what will pop up is a website that says Nursery Plant Sale Flying Advertising Flyer, Johns Hopkins. And then you click on that, and what you will see is a poster advertising Lyme. And in the corner of it, it says Nursery Plant Sale Advertising Flyer. What I'm trying to tell you is that basically Lyme has been flying under the radar for some reason. And there's no reason for it. It's a public health education program. However, some of the reasons why they are not being public about this public health program, I think will be revealed as I continue. CDC Lyme policies and programs, as I said, they are not based on the best science. They're not even based on good science. How can I make this claim? I'm not a scientist and I'm not a medical doctor. I'll tell you how. There are advisory boards to the federal government to help them do their best work. One is called the Council of State and Territorial Epidemiologists, the CSTE, and it provides the CDC disease surveillance guidance and also talks to them about disease diagnostic guidance. In 2011, the Council for State and Territorial Epidemiologists advised the CDC the following. They said that the two-tiered test being used by the CDC and being promoted by the CDC to diagnose Lyme is not to be used for clinical diagnosis. It is an inappropriate technology. It is very inaccurate. That was in 2011. The CDC ignores this advisement. This is the job of this organization, to advise the CDC, and yet they're ignoring this information and this advisory recommendation. The tests that are being used for diagnostics are 50% inaccurate. I was recently in Washington. I met with staffers to senators and congressmen, and one said, is there a better test? And there really isn't a very good test out there, but that does not mean that you use a bad test as a clinical diagnosis. What you do is you use a clinical diagnosis based on the symptoms. The tests are there only to help support that diagnosis, but you go based on the symptoms. Lyme disease is a clinical diagnosis. It is not to be done using these very bad and inaccurate tests. And that is something that other advisory boards recommend. There are also other agencies. The Agency for Healthcare Research, Criteria, and Quality produces evidence to make healthcare safer, and they're under the Department of Health and Human Services. And under them is the National Guidelines Clearinghouse, which is a website that promotes and posts good quality guidelines for medical care. And these are evidence-based clinical practice guidelines that meet their criteria. Okay. The CDC promotes the Lyme guidelines from the Infectious Diseases Society of America. These guidelines are the only Lyme guidelines being promoted by the CDC, and they have failed the criteria set by the Agency for Healthcare Research Criteria and Quality, and they have failed the criteria for the National Guidelines Clearinghouse, both of which are part of the federal agencies who advise on these matters and review these matters. In addition to that, there's also an independent advisory group called the Health and Medicine Division. It used to be known as the Institute of Medicine, and they are independent, they're non-governmental. They have the standards for developing trustworthy clinical practices guidelines. And they also have the grading of recommendations, assessment, development, and evaluation working group. They also reviewed the IDSA Lyme guidelines, and they said that they do not meet grade, and they do not meet their standards. So now we have 4 different independent bodies telling the CDC that the diagnostic tests that they're promoting are inappropriate and substandard, and that the Lyme guidelines that they're promoting are inappropriate and substandard and non-compliant to basic federal standards for evidence-based science. And yet, they continue to promote them. The CDC is also promoting the IDSA's mischaracterization of Lyme disease. IDSA and CDC claim that Lyme disease is hard to catch, easy to diagnose, and easy to cure. Multiple letters to the CDC asking why are you promoting these non-compliant and outdated substandard guidelines and tests. And they say repeatedly in writing that they represent the best science, which simply is not true. What happens as a result of these poor standards being promoted, not only in this country but globally? Well, in this country, what it means is that we are continuing to have an epidemic that is growing. We have at least 329,000 new annual infections. That's between 900 and 1,000 new infections per day, or 40 new infections per hour. 50% of the people who do get tested will be told they don't have Lyme disease when they do have Lyme disease. Rather, of all those who get tested, as many as 50% of those tests will be inaccurate, and people will be told they don't have Lyme disease when they do. In that situation, they will have a delayed diagnosis, and because of that, they will have very serious systemic complications. And these may include serious heart, nervous system, immune impairments, organ dysfunction, life-altering damage, and death, all because of outdated and substandard guidelines and testing being promoted by an organization that is supposed to protect our public health. Then, if you get a positive test, according to the CDC, you will be given 1 month of antibiotics, which is according to the IDSA Lyme guidelines. This will fail as many as 36% of the patients. It will not get them well. It might knock back the symptoms, but by the time they get diagnosed, the infection will have already been systemic. What is happening in this country as a result of these bad practices, these bad science on the part of CDC? Well, what's happened is that many different states are trying to protect their constituents. In our country, there are more than 25 states now that have laws that have been passed or amended to protect its citizens from the bad science of the CDC. And there are more pending. What does that mean? It means that basically states have recognized that people are getting very sick from Lyme, and the CDC is not doing a good job in protecting them. So you have laws that include patients being told, for example, in Maryland and Virginia, when you get a Lyme test, your doctor has to give you a piece of paper saying that just because your test is negative, it does not mean you do not have Lyme. That's the kind of laws that are being passed in multiple states. Now, the 25 states I mentioned, which is half of the country, that does not include all the states that have Lyme awareness legislation. I'm talking about protective legislation that helps patients understand that a negative test does not mean that they don't have Lyme, that they have treatment options beyond the IDSA guidelines, and that doctors who treat such patients beyond the IDSA guidelines are well within their rights as treating physicians to provide these options for treatment. These are protective laws put in place because the CDC is promoting such poor science and medical guidelines. Now, the IDSA does not like these laws. And in fact, in 2004 and in 2006, when they had their annual meetings, they actually had agenda items to oppose patient legislation initiatives and to defeat patient-sponsored legislation. Why would the IDSA want this to happen? It doesn't make any sense. However, they are doing it. On the IDSA website, if you go there, you will see that they have tried to undermine state legislation in California, Connecticut, Maine, Maryland, Massachusetts, Minnesota, Nebraska, New Hampshire, New Jersey, New York, Ohio, Oregon, Pennsylvania, Rhode Island, Texas, Vermont, Virginia, West Virginia, and Wisconsin. It's amazing that a private medical society would want to undermine state rights to protect their constituents against bad science and bad medicine advice. Why is all this happening? It doesn't really make any sense, does it? Well, now we're going to discuss why it is happening. Basically, the IDSA has a lot of power, and this power has been escalating, and they have been setting federal Lyme policy. And this has been going on for some time now. In 1999, IDSA had 3,000 members. In 2016, they have over 10,000, and they have international affiliates. They've gained power because of new epidemics, the 9/11 terrorist attack, their relationship with Big Pharma, close relationship. They are working with the Department of Defense, they're working with the CDC. Basically, infectious diseases specialists are more and more important in this time of global pandemics that are emerging very quickly, and also the increased threat of bioterrorism. These changes have amplified the essential role of infectious disease specialists, and these are the people who make up the IDSA. Now, I'm going to just say right now, not all members of the IDSA are part of this issue with regards to Lyme. I'm sure many of them are doing very, very good work in many areas of infectious disease. So when I refer to the IDSA members, I'm referring to those who have been involved with the Lyme guidelines and the Lyme programs. Okay, now on the national security front, ID activities, which is infectious disease activities, includes vaccines, drugs, therapies, diagnostic tools for public health emergencies, and they also act as first responders to microbial threats, whether natural or terrorist related. And the members of the IDSA are very well placed to direct research dollars. They sit on medical journals, they're in research institutions, international medical bodies, institutions of higher learning, federal, state, and county bodies. So they're very good at helping direct flows of research to infectious diseases of various types, including Lyme disease, and determining what gets published because of their positions on medical journals as well.